In 2006, I got this from a study that I just read yesterday. $2.1 trillion were spent in America for healthcare. $2.1 trillion. And 1/3 of that cost was borne by employers. The rest came from a variety of sources: Medicare, Medicaid, insurers, personal out-of-pocket. $2.1 trillion. That's how much illness cost us. So it's very important to take time from a financial point of view. I know this personally because I started out my career as a Wall Street lawyer. Let's go back to 1986. I had just graduated from law school and passed the toughest bar exams in the country. I was recruited by a top Wall Street law firm. So I was very excited. I pocketed my starting bonus, bright lights, big city, fat salary, in my 20s, completely excited. Within a couple of years, I was flat on my back in bed, in the hospital, and I had suffered burnout and exhaustion. I was eventually diagnosed with chronic fatigue syndrome. Fortunately, I had a mother who would take care of me and let me come in, but I come home. But the point was I could not work, so I was completely unproductive. I could not buy my health. The money I had earned, the bonus that seemed so impressive when I started my job, that was pretty meaningless because I couldn't purchase my health. And I could not get better. It's a result of stress, and you reduce your immune system, and then you continue to get one illness after another, and it's very hard to restore your health. And I had been very passive with the healthcare system, and I've been waiting for that doctor to tell me what to do. Tell me what to do. I need to get better. And then, after my hair started falling out, because that's a big wake-up call, you know, we all want to be beautiful and healthy too. I got it. The answer was not in that prescription pad. The answer lay inside of me, because only I had the power to truly create my health. From the inside out, I had the power, and only I could make it happen. It didn't matter how many people around me loved me and supported me. I was the one that had to make that personal decision to be healthy. And so from that day forward, I spent every minute I could learning everything that I could about how to promote health. I became my own student of this topic and read voraciously, and ended up working at the Stanford Prevention Research Center. And 15 books later, I am still very passionate about this subject. And there are so many things that you can do. And I write a blog right now, and I also write a monthly column on Mind, Body, Spirit News, because the mind and body are very closely related. A lot of our thoughts and emotions affect our well-being. And I stay very in touch with the research. So I'm going to share some tips with you. Hopefully now you're excited to learn about how you can be well. And it doesn't have to take a lot. I mean, Kelly says she doesn't exercise, and Lisa's describing that she doesn't exercise. I exercise. Oh,